So new technologies and new modalities of care in the home have been emerging. As we said, the pandemic has really accelerated and fueled the development of telemedicine. And right now, I'd like to introduce Susan Vail and Al Evans. And Susan is a care manager with EverHome Care Advisors. Need to advance. And she has 25 years working in the, or 20 years working in the long-term care area. She was a discharge facilitator at a rehabilitation facility here in Albany. She's a member now of the Aging Life Care Association. And in her current role, she works with individuals and families in developing that individualized care plan and bringing care into the home or transitioning care to other settings. And I'll introduce Al at this point. Al is the Vice President of Technology for ApolloCare LLC, and he has spent 25 years in technology management, developing web mobile applications, and working on a revolutionary app that integrates a suite of home care services through a single user interface. And Susan, tell us the work that a care coordinator does and how that leads in, and then we'll introduce Al and the topic of the technology.
All right, thank you so much. As we have all discussed and we've all experienced, COVID-19 pandemic changed how we did things. For families that were stable and things were okay, it sent everyone into a crisis mode. We've talked about the social isolation, and the services became harder. When I'm helping families to help navigate through how we're going to find care or get their loved ones home, we look for those care options. And it has, on top of the pandemic, there's, as most of us know, there's a caregiver shortage. It created a whole different issue and barriers that we had to face. And the adult day programs are still closed, and there are other barriers that we will talk about that we don't know. I mean, we're starting to come to the end of the pandemic, maybe. Everyone's guarded. People are allowing people into their homes a little bit more. But one bright spot as a care coordinator, because I'm able to go into the homes and do a comprehensive assessment and care plan where I can go in the home and help with troubleshoot, help find those solutions. One of the bright things has been the use of telehealth and the expansion of technology in the home to give people independence and more control over their ability to age in place. In our next slide, we're going to look at, as an aging life care professional, I'm a member of ALCA, which is the Aging Life Care Association. What delineates an ALCA member from anybody else is that we don't focus in one area or one area of specialties. We have experience and ability to look at all aspects, and you can see those on the screen. Anything from crisis intervention to advocacy, housing, financial. We look at the holistic person, the holistic situation, and we find that person-centered focus. And we look and we address all of these items. In our next slide, with EverHome Care Advisors, who is who I work for, we have life care coordinators and we guide the clients. We don't make any decisions. We're not going to take any control away from them. We empower them to make educated decisions on what's going to work for them. The model we use is AIM, and you may have heard of triple AIM, but our aim is we're going to do an assessment, implementation, and look at monitoring of how that plan's going. This can be for someone who has decided to have us do a comprehensive assessment and care plan, or it could just strictly be someone who needs help troubleshooting their loved one or themselves coming home from a facility or institution. It's very personalized, and we're able to look at all aspects. So are there family caregivers? Are there resources that they have? Do they have a long-term care policy? And what are the benefits for that? What is the elimination period? But we also look at technology, and we had always been looking at technology, but like I said, since the pandemic, this has really accelerated. And we're going to talk a little bit in a bit about pilot program we have going on, or will be starting in Columbia County, where we try to integrate the technology so that people can age in place and live their life the way we want to. And technology is great, but you also have to have that care manager or care advocate with you to monitor, because what works now may not work in the future. So in our next slide, we're going to talk about how this care coordination and technology works. Biggest barrier, and I faced it with my loved ones, is technology scary. I'm of the age where our parents couldn't figure out the VCR. Well, now we have smartphones, fitness apps on our watch. We have all these things, and it can be very overwhelming. They're looking for simple, hands-on solutions that they can incorporate into their life. So what we'll do is we'll talk with a client to see what their needs are. We'll do an intake and assessment. We'll continue the process as you see posted here, and we'll design that care plan. That care plan can be something as simple as a resource in, or it could be very comprehensive, looking at physical, functional, psychosocial needs, health and wellness, financial health, and legal health. We like to consider ourselves one stop, so we're able to, someone comes to us, we don't staff for care, but we can provide those linkages. They don't have to go to another agency and then another agency. Many times when the people we deal with call, we're giving them a number or a website, and it directs them to another one, and then another one, and then the cycle just keeps going.
Susan, we have about another minute before we turn over to Al.
That's absolutely fine. And we look at how we can guide them, advocate, and have that reassurance of, Sue, I know you said this, but now I don't know what to do. Can you repeat that again? So we're there all along the way. And one technology that we love is hands-free, and we'll talk about that in a little bit. So in this next slide, as I wait, if you could advance the slide, please.
All right, very good.
The technology that we look at is not just one solution, and it's not a substitute for human care. Rather, it's the automation and efficiency that provides what makes the care better. It takes a village to raise a child. It takes a village to help a senior age in place. And it's my pleasure to introduce Alan Evans. He is our Chief Technology Officer for technology and all those resources. And Alan's going to share a little bit more about our technology and our technology partners.
Well, thank you, Susan. And so that example of that technology and automation that Sue is referring to is what we're calling the Vivalinks platform and mobile application. We're building a foundational approach to enabling seniors to age in place in their own homes. Now, we heard a lot this morning about the growing senior population, the inevitability of that, and the seniors that want to remain in their own home, and the growing lack of caregivers and the cost of caregiving itself. We believe as Vivalinks, we can be a significant part of the solution. So basically, by taking a platform approach where we plug in the best of breed home care technology solutions, we're enabling a better approach to aging. So in our solution, there are 5 primary components to this platform approach at this stage of our development, with the first and primary component being the human touch. It's that human element that the life care coordinators provide as represented by EverHome, and the compassionate and knowledgeable care that they provide, just as Susan expressed so well. So our primary technology partners, as you see here, these are the ones that we're plugging into this initial version of the Vivalinks app, and which include the following. So you see Ecaring there on the left, on the lower left. This is the tool which tracks the aging senior's condition in the form of electronic health records. Alarmcom, just above that, provides sensors and communication technology that is installed in the home for real-time activity monitoring. UCM, the recently renamed UCM Digital Health, they're always there, ready for any critical situation that requires emergency intervention, with doctors that have a complete picture of what's happening in that home. And then you see EverSafe. EverSafe is the first financial protection service that will be plugging in to the platform to prevent fraudulent activity across the senior's financial accounts. So let's dive a little bit deeper into the cameras and sensors technology that Alarm.com provides. First, this technology is designed to support the ability for seniors to age in place through the home-based real-time tracking and monitoring capabilities. With its built-in intelligence, the system learns pattern and recognizes when things are normal and when things are not. Alarm.com uses these capabilities for daily and enhanced nighttime safety monitoring and alerts. Also, through connected personal devices with fall detection, emergency responses can be initiated without direct intervention. And with integrated voice and cameras, hardware, seniors and families can stay in touch with these two-way communication systems. So let's talk a little bit about Ecaring. Ecaring is plugged into the Vilinks platform and provides additional real-time capabilities. Through Ecaring's healthcare records, the primary caregiver is empowered to manage the senior's condition. Ecaring is an easy-to-use, icon-based system tailored to each condition and used continuously to update care information. Now, in the future with Vilinks, caregivers and family members will be seamlessly connected across the entire healthcare digital ecosystem. And at any point, they can receive real-time alerts through continuous monitoring on their own devices. So how does this work with the two together? By incorporating both of these leading edge care platforms into a single cohesive solution, we empower caregivers with improved communication and collaboration. This provides easy access to information collected through real-time systems, from digital healthcare records and sensors, and direct communication between the caregivers themselves. This provides and enables timely and effective interventions, which leads us to the triple aim of a better senior care experience. Better outcomes through reduced ER visits and hospital admissions and fewer doctor's visits. This results in reduced costs of care, both individually and collectively. This provides a primary caregiver with welcome stress reduction and gives family members peace of mind, knowing that their loved ones are okay. Now, this is all going to be made possible by Vilinks, a complete and robust solution that connects primary caregivers, care providers, physicians, hospitals, and families through a data-driven platform and mobile application. So let's talk a little bit about our telemedicine on demand, which we're calling our ER at home. Now, this is for emergency intervention when there's a significant enough event that requires an emergency call. Care teams are connected to UCM Digital, which puts them in direct contact with an emergency doctor. They can be called any time of day or night, 24/7. And in terms of effectiveness, we've just recently learned of a study carried out by UCM Digital, where they found that a pilot project in Rensselaer County reduced trips to the emergency room by an astonishing 97%. That's just simply unheard of. So it's clear that this service has significantly expanded, and in no small part thanks to COVID. So the pandemic really has helped accelerate the adoption of telehealth. And at this point, there's simply no going back. So we'll talk a little bit about our fifth component, and that's financial security. Starting with EverSafe, this is going to be our first component in terms of financial security. We're able to monitor the senior systems in real time to ensure the integrity of their accounts. Financial security will be a great complement to our previous discussion around the Compact for Long-Term Care. So as part of the future of Vilinks, will have the ability to track participant contributions and facilitate the allocation of funds applied to long-term care services. Vivalinks can be not only part of the methodology to manage the compact, but it can be also a paid component of the compact moving forward. Oops. So we've been talking a lot about Vivalinks. Let's just highlight where we are in terms of the development of the platform. As Susan mentioned, we've just initiated a pilot for 400 homes in Columbia County, and the participants will be defined by their health status and payment type. The program duration is going to be 24 months. Right now, we're in our 6-month MVP development phase. The MVP is our minimum viable product, and that's going to be the product version that's going to be tested during this pilot. We have a full team of technology developers in place that are experienced software and application developers. We have a healthcare solutions architect. We have 2 senior developers with experience in healthcare and educational application development. We have a really experienced user experience designer, and we have a whole team of developers and QA and analysts that are going to help us with modeling and understanding the data and reporting on the pilot's efficacy. That's a very important and critical stage of this process. And then we're also defining the financial components and establishing the longer-term roadmap for the product. We begin deployment to homes in Columbia County starting January 1st, 2022.
Excellent. Thank you, Susan. Thank you, Al. The pilot is very exciting. And as Greg Golson mentioned, we're working very closely with New York State Office for the Aging. They have a number of these developmental pilots going on across New York State, looking to innovate, looking to bring solutions to change the model. And I'll go back and quote Gail Holubinka. For years, what we've done with regard to long-term care is rearrange the deck chairs on the Titanic. We think that doing the same thing over and over and over again is going to create a different result. COVID maybe has spurred telemedicine, and maybe we can tag along with that and bring some innovation. So this pilot in Columbia County is a very exciting opportunity to get that technology in place and see what the results are. We already know from our component partners what their results are. So very exciting stuff. And we hope to be able to next year report on the results of the first phase of the pilot as people will be enrolled and utilizing the technology.